Hello and welcome viewers. We are at BW Healthcare World Oncology Summit 2023. I am Bhupendra Pantola. With me I have Dr. Indu Bansal with me. First of all, ma'am, welcome to BW.
Thank you so much for having me here.
So ma'am, first question I would like to ask you is what are the latest advancement in diagnostic, cancer diagnostic as well as treatment in cancer? And can we have alternative treatment for cancer apart from chemotherapy and radiotherapy?
Okay, so that's a very, very important question. I think oncology is one field where a lot of technological advancements are happening, not just in the preventive aspect, but also in the diagnostic sphere, treatment sphere, rehabilitation, which is a very, very important aspect of cancer care, and of course, in treatments, as I said. Like when I started my journey 25 years back, then there were not much good tests available to diagnose cancer, but now we have PET scans, we have MRI guided machines which are coming up for radiation treatment like MR-Linac, and where we have so many the tests have become much better. Now we have so many molecular tests which have come up. So because of that, we are able to give a personalized treatment to the patient. Our surgeries have become much more efficient. They are much more cleaner. They are much more organ preserving, and we are able to preserve the organ. Similarly, radiation treatments have become more precise. They have become more focused, and we are able to just hit at the target and at the same time save the neighboring structures from the toxicities of treatment. Coming to chemotherapy aspect, then of course we have now oral pills which we never thought could be available. We have targeted drugs, like there is some drug which is known as imatinib, which was considered a magical drug for treatment of chronic myeloid leukemia. So similarly, so many drugs are coming up in oncology sphere. And apart from that, now we have, as I said, talked about rehabilitation. So we have voice prosthesis. So even after laryngectomies, even after removal of the voice box, the patient is able to speak up. So, and more our patients are being diagnosed at an earlier stage. They are being treated, they are living longer, and they are not just living longer, but they are leading an absolutely normal life. So oncology is an emerging field, and every day I would say a lot of advancements are happening in oncology. Yeah.
So, ma'am, it takes a different kind of attitude for a cancer diagnosed person to transform from cancer victim to cancer survivor. In your personal experience, has there ever been a patient from whose attitude you have been astonished, and you'd like the viewers to share those kind of experiences?
Oh. So as I said, I'm very happy that you asked this question. Two things that I would want to point out here. Number one, I don't like the word victim. I call them winners of life. So for me, there is nothing like cancer victim. I call them winners of life. And I don't like the word survivor, because like, if you, for me, I might be saying something which many people may not agree with, but diabetes, hypertension, cardiac diseases, so many people are diagnosed with them and they live for many years. And we never use the word he's a diabetes survivor, he's a hypertension survivor. For oncology, now we can detect patients even in stage 0 or in stage 1, where patients live longer. And if the patients are diagnosed at these stages, then the treatment is for a very short duration. Okay, it might be for a few months, they might be treated just with a single modality, and they're leading an absolutely normal life. A diabetic patient has to take treatment lifelong, but an early stage cancer patient, they take treatment for a very short time and then they live absolutely normal. So I don't, if we are using the word survivor, in a way we are sending a message to the society that if you have survived cancer, it means it's a very big thing. So it gives a negative message not to go for cancer checkup. So I said I'm going to make a controversial statement here. Now, talking about if I have come across any patients, of course, there are many. I mean, in 25 years of journey, I have patients whom I treated 15, 20 years back, and they're leading an absolutely normal life. I had a patient who was 90 years old, diagnosed at 85 years of age, and at that time, a lot of questions were going about should we treat that patient or not, and we decided to go ahead with the treatment. And at 90, he wrote two Punjabi poetry books, and he gifted this to me, or he gave it to me. I have a young patient who is 5 years of age. He had some brain tumor, now cured, and at 5 years of age, he started a YouTube channel. So, if what I want to convey to the audience here is that it's not the diagnosis which matter, but what matters is what do you do with that diagnosis, how you deal with it. Do you stop living with that diagnosis, or do you still live and create a difference in the life of others, like these two people did? So, I tell all my patients, even with cancer, you should have your bucket list. You should keep on ticking the things in your bucket list that you want to do. And rather, if you have some motive to live on, these patients, they stick to their treatments, they are more compliant with their treatments, and they do well because they want to live. So, have that desire to live in spite of the cancer diagnosis. This is what I would like to convey.
It's the desire that actually makes person, overcome the obstacles and all. Using your terminology, ma'am, the suicide sticks and the suicide masalas, how important do you think, tobacco taxation will play a role in mitigating the cancer cases? So recently in the budget, Sitaraman, finance minister, she has increased 16% taxes in cigarettes. When it comes to India's commitment to WHO, it is said that 75% should be on the taxation on tobacco products, whereas in India it is 52% on cigarette, and on BD and other masalas it is less than that. So, what would you say that what role does policy plays in by taxation in mitigating?
So it's a very, very important question. As I said, that cancer cannot be controlled but just by an organization or by an institution. It has to be a multi-pronged approach. So it starts with the own individual. Everyone knows that tobacco causes cancer of 16 body sites. So wherever the tobacco smoke goes, it destroys everything. It's starting from the nose to the mouth to the food pipe to the stomach, pancreas, gallbladder, urinary bladder, kidneys, penile cancers. So it causes cancer of 17 sites in the body, and tobacco alone, because of it, 3,500 people every day they lose their life. Similarly, alcohol is responsible for around 6% of cancers, and this is, I say, tobacco is one product which kills its most loyal customer. The more you consume, more you are at risk of dying from it. And the people who take tobacco, they also take alcohol, majority of them. If you take either, if your risk is 8 times, if you take both, then the risk straight away increases to 28 times. So of course the taxation is definitely going to help, because if it's not available, then of course, and if it's more costly, then the consumption would be less. But at the same time, we should not forget that these companies are very, very smart. Okay. Now that's why a shift is shifting more from smoked tobacco to smokeless tobacco. Okay. That's why I say they market it as pan masala. Okay, and in fact, you won't believe there are so many toothpastes also coming up which have tobacco as a main ingredient in it. So we have to not just put taxation on tobacco products, but also at the same time, we have to keep a watch in what other products it is being still marketed as a hidden ingredient. Okay, and most of these products, they are available near the schools. So, like if you see, there is a mushrooming of liquor shops at every chauraha in India, and they are much bigger shops, and of course they are so easily available that people find it very easy to take it. So, apart from putting taxation, we should we should make these things less available. There should be strict laws which prevent sale of these products close to the schools, because that's the time 12, 13 year olds, when they start smoking or they start taking unhealthy sexual practices. So we need to target schools. I would have done maybe close to 500 cancer awareness programs where I spoke more to children of 10th and 12th class, where I spoke about side effects of tobacco, alcohol, unhealthy sexual practices, importance of diet. So I think I'm very happy with this step, but we need to work more on this.
So we need to create an ambience which doesn't allows or which doesn't give you any impetus to go and take this kind of. Also, ma'am, I think in youth, because we try to practice nihilism, or as if there is no purpose to life. There is this concept also in youth. At times, we also tend to just try new things out, and in that way, we get into this trap of tobacco products. Last question, ma'am. When it comes to Indian healthcare, what are the loopholes that you see with respect to cancer treatment and diagnosis, and how those loopholes can be rectified according to you?
Okay. So I must say that government is definitely doing its bit. Now a lot of cancer has is services are more available, and earlier these facilities were not available in tier 2 and tier 3 cities. But now a lot of private hospitals have come up in close by cities like Panipat or any small tier 2 cities. So, but the problem in India is, as compared to NHS, where the health is available to each and every individual, we have civil hospitals, we have district hospitals, we have primary health setups. But actually, are we offering that quality of care? It's when a person goes to a government setup, the appointment time that they get for a cancer treatment is sometimes 5 to 6 months gap, and in that time a patient from stage 1 cancer may become a stage 4 cancer. So number one, we have to make these services more available. Number two, I think there can be some triaging done. Triaging means that patients who are curable or patients who are coming up in early stages, say a vocal cord cancer, they are curable cancers. So where if a patient has come up early, in early stages, and it's a curable cancer, we should give more priority to those patients for cure. And of course, we cannot let people in stage 3 and stage 4 suffer. So we should make palliative care services more available to for those patients. There could be some vans which visit the patients at home. They are providing health services there. So diagnostics should be more easily available. The price of treatment should come down. And of course, the government hospitals have to step up and keep up with the latest of technology, reduced waiting times, and maybe there should be, if that's not possible, then at least there can be some collaboration between the government hospitals and good private hospitals which have everything. And maybe because of those liaisons, the treatment could be cheaper. Or maybe what can be done is, like if I talk about radiation therapy, the centers where the treatment is costly and the patient is not able to get treatment, if there's some government partnership with those institutes, we can treat those patients in the evening hours or something. The jobs for cancer patients and survivors, that's a very, very important thing. I mean, so many patients lose their jobs. The caregivers, they lose their job because they have to take time off because for taking the patient to the healthcare facility. So we should be more liberal, or there should be some laws which permit the cancer patients and their caregivers to work from home, or they should have some flexible work hours which can make their life much easier. So lot needs to be done. There should be more vaccines, like HPV vaccination should be a part of immunization program. It should be made available to children. Hepatitis B vaccine, which can prevent against liver cancers, which is a very
It's not
deadly
just
cancer.
one factor, but the holistic approach
So
needs to be
I
there.
think education, most important step is educate. Educate, prevent, screen, treat on time, rehabilitate, constant follow up, and and rehabilitation of patients in the society. The stigma of cancer needs to be removed. It's now becoming a chronic disease. So these people should be accepted more in the society. Then only we will be able to do our bit to improve the lives of cancer patients.
So these were the points that our doctor has mentioned, and I think after listening to her, our viewers will be more aware over this topic and they will act differently. Um Wishing you all a very good health. That's it from our side. Thank you so much, ma'am, for talking to us. It was pleasure talking to you. That's it. Thank you.